The second American doctor with the Ebola virus arrived today in Atlanta. She's the second American to be infected with the virus brought to the United States. The first arrived with the virus earlier this week. But as our Scott Sheehan tells us, Essentia health officials in Brainerd think there'll be little impact of the virus in the United States.
Ebola, a deadly virus that has infected patients in 10 African countries. Today, the second infected American doctor with the virus arrived in Atlanta. However, health officials in Brainerd don't think it'll affect us.
There really should be very little impact in the United States. They're really doing their very best to contain the virus where it is. They're doing screening of all people leaving those countries so that they can screen them for signs and symptoms of the disease before they leave.
The Ebola virus is a fever. Some of the symptoms include diarrhea, vomiting, joint pains, muscle aches, and in some extreme cases, hemorrhaging, bleeding on the inside and outside of the body. And health officials say the virus doesn't spread through the air.
You can't get it from just sitting next to somebody. You would have to have contact with Ebola patients with any of their blood or body fluids. So it's a fairly contained subset of people that would be at risk for transmission.
With little known about the Ebola virus, the Minnesotans that I spoke with today are split on whether or not they should be concerned with the virus spreading.
I'm sure those people with their environmental suits are taking all the care in the world to keep it contained. It would be a work of science fiction pretty much to have it get out.
Why would you want to take and risk that something might happen? Is the part that I'm not real happy with.
If it starts, if they can contain it, quick enough, it's not so much.
I'm concerned about it because I don't know enough about it to be able to know what the signs and symptoms are to know if somebody has it or not.
Essentia Health says they have a list of what to look for from infected patients. They also recommend their patients talk to them before taking trips abroad.
So if you do have some plans to travel, it's always a good idea to check with your provider or check with that international travel office to see if there's anything preventative that you can do to take care of yourself before you even leave.
Essentia Health says we should rely on the Center for Disease Control and the World Health Organization to do their job and contain the virus. Scott Sheehan, Lakeland News.
And for more information about the Ebola virus, you can visit our website at lptv.org.
If you've enjoyed this segment of Lakeland News, please consider making a tax-deductible contribution to Lakeland Public Television.